Since the advent of the internet, diagnostic information about Parkinson's disease and multiple sclerosis is being shared abundantly, and people are starting to learn the truth that lesions showing on an MRI is in no way a sign that a person has either of these two diseases. In fact, around 50% of the Parkinson's and MS patients who have attended my 5-day treatment program who have had an MRI have explained that they had no lesions showing on their MRI. Here are several Parkinson's and MS patients who will confirm this to you. What is the name of the neurologist who carried out your diagnosis?
Pedro Guajardo. He's in Monterrey, Mexico.
Now, did he do an MRI on you?
Yes, he did.
Did he find lesions?
No, he didn't see anything abnormal.
Nothing abnormal on your MRI?
Nothing abnormal.
So then how did he arrive at the conclusion that you have Parkinson's disease?
He asked me to do a couple of things, like to walk, and he saw my face. He concluded that because of the symptoms he was...
From the symptoms, right.
Yes.
Can you just say your name? Where do you come from?
Currently living in Huntsville, Alabama.
What have you been diagnosed with?
Parkinson's.
And what is the name of the neurologist who carried out that diagnosis?
Dr. Watts.
And did he do an MRI?
The previous doctor before him had done an MRI.
And did they find lesions?
No.
No lesions at all?
No lesions at all.
Right. Could you tell me your full name?
Shivika Johar,
Where do you live?
Toronto, Canada.
How long have you been in the wheelchair?
2 years.
What is the name of the neurologist who carried out your diagnosis?
Dr. Lee.
Did he do an MRI to see if you had lesions?
He took one MRI when I was diagnosed.
At that time in 2008, no lesion
No.
in the brain.
Your first MRI and you had no lesions?
No.
No.
How bad were you at that stage?
Like she was walking, like
Holding balls.
holding walls or with a cane.
Right.
Then they did another MRI in May.
Then they found lesion in the brain.
Many lesions?
No, he said, oh, there is a lesion.
There is a
There
lesion.
is.
And he took another MRI, still lesions increasing.
Were you in a wheelchair at that stage?
Yeah.
You-
He took another MRI in January this year, 2010, but it was stable.
There was
But
no lesions?
no lesion at all. He
Not
said
one
no.
lesion?
No.
Okay, so now, are you able to stand up on your legs and hold your body weight standing? You can't.
If-
My name is Alba Galeano. I am 66 years old.
And you live in Brooklyn?
Yes,
And you were diagnosed with Parkinson's disease?
April 16, 2009. A general practitioner. His name is Albert Rosso.
Okay. And your neurologist?
This is Dr. Balderrama,
And where is he from?
Manhattan.
Manhattan. Okay.
Yes.
Did either of them do an MRI that showed lesions? Where is that MRI? Here.
It's over there. There is a
It states here, no bony destructive lesion is appreciated. No evidence of intracranial mass effect in this patient with tremors. This is a radiology report, East Manhattan Diagnostic Imaging.
yes.
Sebastian, what age are you? What age? Sorry? 59. Did they give you a brain scan when they gave you your diagnosis? Did they ever find lesions in the test?
Start with you.
No lesions.
With the paperwork.
Sorry? In the brain or on the spinal cord? No lesions.
How do you pronounce his name?
Yes, I know. He's the one we put a...
Here are some videos now of Parkinson's and MS patients who testify their neurologist didn't even request an MRI to look for lesions, that they made a diagnosis by observing their stiffness and other symptoms that are assumed to be associated with these two, in my opinion, imaginary diseases.
This Suzanne Jane Louis. I'm 63.
Yep.
I've been diagnosed with Parkinson's since 2010. I live in Newcastle, Australia.
Yep. What was the name of the neurologist who carried out the diagnosis?
Initially I went to Dr. Catacar's rooms.
Was there an MRI done?
No,
So they didn't look for lesions?
no.
So they just observed your symptoms and came to the conclusion you had Parkinson's?
That's right.
All right. And what was the name of the neurologist who carried out that diagnosis?
Jenny, do you remember the guy?
Dr. Elkis.
Dr. Elkis.
Dr.
South-
Elkis?
Yeah.
South Flemish.
How do you spell that? Elkis?
And,
Did he do an MRI?
No.
no, he did
So
not.
he-
He watched me walk, he watched me,
So he just made the diagnosis on observation of symptoms.
Right.
yeah.
And you and I both know that those same symptoms that you have can be experienced by the average person who comes in off the street with really tight muscular system due to ongoing stress. Correct?
Yeah.
A person can even have numbness and tingling down the side of the face because of really tight neck muscles and a misaligned C1 or C2, correct?
That's why you can find TMJ involved on one side or the other.
Diagnosed with Parkinson's when?
Approximately last April, 2011.
April. Okay. Right.
So I was in having a physical, and I asked the doctor about it, and he recommended a neurologist.
Yep. Yep.
And so
Right.
I didn't care much for his test. And he walked down the hall, and
Yep.
then he says, "That's what you have, let's start you on medication."
So there was no MRI done?
No.
Okay.